Does it look okay? You want me to rebalance?
Just like give me a thumbs up when like ready to take.
She's just walking in now, so let's see if she can get
So what it is, I guess. So as soon as she joins, so that we're not, so it's all.
Yeah, absolutely. And then is somebody going to work the desk? How's it? Should we find out? We don't need to be around the number of people. That's another thing.
Yeah, I did everything I needed to do over there.
The problem is we don't know. We haven't done an audio check with her. So
They only did audio check with me.
I know.
Okay.
Hello.
Good morning, Sue.
Hi, good morning, sorry.
Good morning. Thank you for coming out today. I'm Mayor Odekirk. I'm going to make some statements. I'm going to turn this over at one point to Sue Olenek from the Will County Health Department, and then we'll open it up for questions. So, a quick update. Inside the city of Joliet, currently we are tracking 384 confirmed cases of COVID-19. There have been 35 deaths within the city of Joliet, and our Joliet Fire Department has reported 70 patients being transported by our fire department. Previously, we were seeing about 30 new cases a day. That slowed down last week to about half of that, to 15 or 16. It spiked again on Saturday and Sunday back to 30, and then I'm happy to report that the numbers have dropped this week. We are seeing about 20 new cases appearing a day. Silver Cross Hospital has reported they have tested 869 people. 54 have tested positive for the COVID virus. They currently have 54 currently are in the hospital who have tested positive. They have 20 persons under investigation within the hospital. 107 COVID patients have been discharged by the hospital, and they're reporting that they currently have 18 ventilators available. St. Joe's Hospital in Joliet has reported that they have 44 positive patients within the hospital. They also have 17 persons under investigation, and they currently have 25 ventilators available. So it's good news that both our hospitals are maintaining very well the load of what's come to them. An update on Stateville Prison. Stateville is reporting 118 positive cases among the prisoners, as well as 70 Department of Corrections officers who have tested positive for the virus. The National Guard is on site at Stateville. They have quarantined the prisoners. They have 4 tents set up, so that's being handled. Again, I said this several times, but I do want to thank Governor Pritzker and his staff for jumping on this issue when it became a problem a couple weeks ago with St. Joe's Hospital. Stateville is reporting that they occasionally are sending prisoners to local hospitals, but nowhere near the rate that was before. And as I said with the hospital numbers, it's nothing that's overwhelming our local hospitals. I want to talk a little bit about Joliet nursing homes. Number one, Villa Franciscan in Joliet is reporting 22 positive cases for COVID-19 within their nursing home. The Park at Joliet, which is 222 North Hames, has reported 6 known cases of COVID-19. Spring Creek Nursing Home at 777 North Draper is reporting 1 known case of COVID-19. Sunny Hill Nursing Home at 1314 Rowell is reporting 1 known case of COVID-19. And Sunny Hill Nursing Home at 421 Doris Avenue is reporting 4 known cases of COVID-19. Obviously, the Symphony of Joliet is the topic of the day. I have some comments to make. First, I'm going to have Fire Chief Greg Blasky address this matter. Chief.
Good morning. Greg Blasky, Interim Fire Chief. Just to give you some background on what we've done with Symphony. In the past 5 weeks, the Joliet Fire Department has received 31 calls for service to Symphony. Of those 31 patients, 10 were breathing but unresponsive, 7 were for difficulty in breathing, and 4 of those were cardiac arrests. Our last call for service was this past Sunday, which was one of those cardiac arrests. Yesterday, I had the opportunity to speak with Allison. She is the Public Information Officer for Symphony. As of yesterday, she stated 16 patients remained on site and all were COVID positive. The staff is working on a 1-to-1 ratio with patients at this time, and all the remaining patients have been tested and moved to other Symphony facilities. Ms. Allison stated that the Illinois Department of Public Health was on site on Tuesday the 14th, but she did not provide a reason for them being on site. Yesterday, I also had an opportunity to speak with the regional IDPH officer, who did not provide any information other than the request for information from us was being sent up to the director, and at this time, I have not received a response. In nursing homes, overall, if you look at the total deaths in the state of Illinois, there have been 1,072 COVID-related deaths. 296 of those have been at nursing homes. That's 27% of our total deaths. The CDC has used the term as an accelerator in regards to the spread of viruses at nursing homes, and there has been over 3,600 deaths nationwide at nursing homes. And if anyone has an issue with nursing homes or would like to report any type of event that they feel is incorrect at a nursing home, we will put up on our website a contact number to the Illinois Department of Public Health where they can either contact them by phone or fill out an online form. Thank you.
Thank you, Chief. Since this came to light, I have spoken with several first responders in the Joliet Fire Department who have related really concerning stories about what they observed at the Symphony of Joliet. So yesterday evening, I contacted Governor Pritzker's office and I relayed the information I'm receiving onto the governor's office. And I'm calling, and I told the governor yesterday, we are calling for a full investigation by the Illinois Department of Public Health into what happened inside Symphony of Joliet. We don't have the answers right now, but we're going to get the answers. And certainly Joliet families, the people who lost their loved ones inside the nursing home, have a right to get those answers. I've spoken with Police Chief Al Rochner. The Joliet Police Department will be available to assist if needed. Right now, I think this is a matter for health officials to get involved and start untangling the mess of what happened inside that nursing home. So with that, I'm going to turn this over to the Will County Health Department, Sue Lennox. Sue, thank you again for joining us this morning. If you want to go from here, thank you.
Sure, thank you, Mayor. Good morning, everybody. Just wanted to give some updated counts for county cases. At this time, Will County has 1,497 positive cases of COVID, and we are at 88 deaths. Those numbers are updated every day. That information is on our website, and we've also provided some information via zip codes and general locations, as well as ethnicity and race. We have been working continually with our Will County EMA, the Emergency Management Agency, and making sure that all facilities within the county have PPE. There is a method, a prescribed method that people make a request through a SurveyMonkey link, and then their request is tracked, and then of course their PPE requests are filled as much as possible. We're not getting nearly what we're asking for. We're not getting nearly what we would like to get. However, so far we've been getting what we need, and there have been almost daily deliveries from our Will County EMA staff to different facilities throughout the county to drop off gloves, drop off masks, gowns, etc. So that seems to be working okay. We've received additional guidance. You know, we get guidance every single day from the Illinois Department of Public Health. the guidance that we've received just in the last couple of days. It has to do with, they finally provided a clinical pathway, which means that there's kind of an algorithm or a process that individuals, providers, hospitals would use to determine when a patient would be admitted, when a patient would be discharged, and what happens along the way. That is a very, very simple, very large simplification of the process, but they did receive that. We received guidance for transport options for EMS, some convalescent plasma treatment. As you know, they're trying to look at ways to develop a vaccine, and they're looking at ways where people that have been infected with the virus now could help in producing maybe a vaccine for the virus. We're trying to work with the governor's office and IDPH to provide additional testing throughout the county. Up to this point, the Will County Health Department, the Community Health Center, we did not have tests. We were not providing tests. So we have not been through with that process. The governor is rolling out an initiative to provide additional testing throughout the state. And so we're going to be part of that. Will County Health Department, we have a FQHC, a federally qualified health center, as part of our health department structure. And they are going to be receiving the test kits, and they will be going around the county doing testing at congregate living facilities. So we're excited about that. I don't have a start date for that yet, but I think that being part of that initiative is going to be important. We still need to gather a lot of information and a lot of data about this novel coronavirus. The data that is available now, it's incomplete, and so is this whole crisis. And so we need to wait until we have good data, clean data, and then we can study it. So definitely having more people tested and tracking that will definitely help in the long run. As far as long-term care facilities throughout the county, my agency works with every single long-term care facility that has cases. They have worked with Symphony at length, and right now, actually, we have about 10 long-term care facilities throughout the county that have cases. Symphony is one of those cases or one of those locations. Our staff is working with many. So it's something that we do on a continuous basis. There are daily check-ins, there are daily logs that are shared, there's information that's shared between my CD staff and staff at all the long-term care facilities throughout the county on a daily basis. That's all I have, in addition to, I would recommend that everybody continue to stay at home. I don't know when or if that will be announced soon, whether Governor Pritzker is going to extend that or going to end it as of April 30th. On the IDPH call that we had with, on the COVID call we had with IDPH yesterday, the director of the Illinois Department of Public Health, Dr. Zeke, announced that Illinois is in fact flattening the curve. So that's some good news. That's the best news I've had in almost 3 weeks. Dr. Zeke is a medical doctor. She is a master of public health, and she also has experience in infectious disease. So if she's telling us, and I think we can take that as a good sign that we are flattening the curve. But please continue to do what all the recommendations are. Stay at home, wash your hands, wash surfaces down, wear a mask, do all those things that we can continue to keep the virus at bay.
Thank you, Sue. I got a couple other quick items, and then I'll open it up for questions. Number one, the Joliet City Center Partnership has announced a grant program to assist with businesses inside the city's special service area. Businesses that have been hurt by this crisis and have shut down. If you go to the City Center Partnership website, you can get the application for that. Our staff is continuously working with social service agencies in Joliet and throughout Will County We've had Mike Hennessy from the United Way here at other press conferences and other social service agencies. I do want to report our staff learned this week that Northern Illinois Food Bank was in need of boxes to help service their customers. We contacted Amazon here in Joliet. Amazon donated 6,000 boxes. So thank you, Northern Illinois Food Bank, and thank you, Amazon, for your donation. The city received, we learned last week, we received through the CARES Act, CDBG funding of $563,000. It's been donated or been allocated to the city of Joliet. Our staff is currently working on that. We are looking to help with housing counseling for refinance or foreclosure cases and emergency mortgage or rental assistance within Joliet. So again, thank you, HUD, for your partnership and for that grant. We are going to work with the Spanish Center in Joliet and with Riverwalk Homes as places where people can go for that assistance and apply for money if they need assistance with rent or with mortgage payments. We got a notice from the Northern Illinois Food Bank tomorrow, April 18th, between 10 a.m. and 1 p.m. They are going to have a fresh produce pop-up. They're going to have a drive-through fresh produce pop-up to pick up pre-baggage packages of fresh produce tomorrow at their South Suburban Center, which is located here in Joliet at 171 South Larkin Avenue. So again, that's open for anyone in the public, but they will be handing out fresh produce for Joliet residents or residents of Will County. And then finally, a citizen who is asking to remain nameless has donated to my office 2,000 KN95 masks. I am going to distribute 500 of those masks are going to go to the Joliet Police and Fire Department. And then following the press conference today, we are going to deliver 750 masks to Silver Cross Hospital and 750 masks to St. Joe's Hospital. So again, thank you to that individual and to all the people in Joliet that have pulled together during this time of crisis. So that's all I have. I would open up for questions then. Yes?
Regarding your the conversation with the governor and the request for an investigation, what was his response?
I talked to one of the governor's assistants. They were concerned and alarmed by some of the information that had passed on, and they agreed that this matter needs to be looked into. And again, I referenced Stateville, which happened a couple of weeks ago. I'm confident that the governor's office is going to be prompt in their response. They've already shown that once here in Joliet, and I'm certain that it'll happen again with this.
Do you guys have specific steps in place in order to get the answers that these families are looking for?
Greg, you want to answer that?
We do not. There is no oversight from the city of Joliet or the Joliet.
Well, I've got this press conference and then I have another 2 conferences after this, but my intention is to reach out to the administration at Symphony today. Our department is getting emails as well indicating that people are not getting the answers, not only the answers they're asking about, but they're just not getting any calls back. So I'm going to reach out to the administrator and ask that they make sure that they're getting back to the loved ones, getting back to the people that are asking questions about the situation. That's important. And I know that they have some serious staffing issues at this point, but they also don't have the same number of residents they had initially. So I do intend to have that conversation today. And just for as a point of clarification, the Will County Health Department works as a kind of a consultation basis with the long-term care facilities. We have actually no authority over them in these kinds of situations. In other words, my team goes out there or has a plan developed with the facility, and we lay out what they need to do. We provide the guidance. We answer the questions, and we have no authority over that. And so sometimes that can pose a problem. I'm not saying that was the problem with Symphony. I'm just saying in general terms that can be a problem. What we do then is if it gets to the point where it's unmanageable or there are things happening that really need to be addressed, then we end up bringing in the Illinois Department of Public Health regulatory side, which means they're the ones who actually license the facility. So any long-term care facility, they have a license, an annual license by IDPH. IDPH conducts some very extensive inspections at the facilities. We do not. And the only thing that the health department would inspect at a long-term care facility would be their food service. We would inspect their food service on a regular basis, just like we would a school cafeteria or a restaurant.
What would you say to family members who have lost loved ones due to COVID-19 complications who were residents at Symphony? And are
Well,
dealing with
what I
this?
would say to them isn't any different than what I would say to anybody, and that is that, you know, when you're looking at viruses and you're looking at pathogens, these illnesses, the, you know, older people, people in their 60s, 70s, 80s and older, they're a vulnerable population. And this was and is a novel virus. We had no idea how it would attack different age groups. Not only are you looking at vulnerable ages, but many of these people have comorbidities. They have chronic illness, and that really lowers their immune system, and so they are vulnerable. It's a horrible thing. Someone said to me the other day that, well, this virus doesn't seem to be too deadly, but you know, I think that anyone who's lost a loved one, and I've heard of families that have lost more than one person in their family, it's devastating. It's absolutely devastating. And I'm really hoping that, you know, we are able to study this. We're able to garner a lot of information about, you know, the pathogen itself, what we did right, what we can do better. I can assure you, most people that I have dealt with, they are doing the absolute best they can with the information and with the quickness that this happened.
I have a question from Sandra Torres from NBC. We know that Symphony residents who were allegedly not infected were transferred to other nursing homes. We have heard from people concerned those patients are spreading virus in nursing homes they are now in. What do you know about that and what is being done?
I'm sorry, I can't hear the question. I heard part of it.
Sue, I think I can answer this. Is what we were referenced by the public information officer is all those individuals that were transferred to other Symphony facilities. There are 26 other ones in Northern Illinois as well as Northern Indiana, that all those individuals were tested prior to leaving and going to their new facilities.
Yes.
Sue, this is for Sue. Do you know, did your department call in the Illinois Department of Public Health to Symphony, or do you know what they're doing there?
Our agency has been in contact with Illinois Department of Public Health, not only on Symphony, but in many of the other long-term care facilities as well. The meeting that went on earlier this week, I was a part of. I was at Symphony with the individuals from IDPH, and they were not all, they're not from the regulatory side. We sat down with the leadership at Symphony, both the management on site and some individuals from corporate, and basically just went over, you know, what they're doing now, you know, walked through the whole process, provided some additional suggestions. The information that was provided by the IDPH individual who has expertise in long-term care facilities and infection control, she said at the meeting that, you know, they're doing what they need to be doing. So that's all I can tell you.
I'm sorry, Sue, could you repeat that again in regards to what IDPH told Symphony at this meeting, that they were doing what they needed to be doing? There were no indication of what might have, anything they did wrong that might have led to this outbreak of deaths?
I'm sorry, can someone?
Okay, Sue, in regards to what you said, the person from IDPH said at this meeting, she said they were doing what they needed to be doing at Symphony. In other words, they did not detect any problems in terms of how patients were being treated that led to this outbreak of deaths?
I wasn't involved immediately when the initial outbreak took place, and nor was I a part of any of those meetings, so I'm not going to speak to that either one way or the other. They were doing a great job, they weren't, I don't really know. But at the meeting that I was at earlier this week, when the infection control person, and there were two physicians out there as well from IDPH, We went through the whole process of what, how they were handling PPE and how they were cohorting patients and how they transferred and, all of that. And at that meeting, IDPH had told them that they were doing everything right. They made a couple of suggestions just in terms of, streamlining some paperwork and things like that. But that's what was said at the meeting.
That's for the mayor.
Yes.
In regards to the concerns that the first responders had at the Symphony, could you go into any detail on that?
I'd rather not. I passed it on to the governor's office, and again, I think the matter needs to be investigated. I'd rather let the investigation stand on its own without being influenced by anything like that.
Okay, also, in terms of the number of deaths at Symphony, are you getting information as to how many people have died there on a regular basis? Can you give any update? Because the latest ones we have they don't seem to be correct.
We do not get any updates from them. If we transport someone from the facility to St. Joe's Medical Center, we do not know the outcome of that unless they test positive for COVID, and then we are notified, so our first responders are made aware that they came in contact with a positive COVID patient. But normally we do not know the outcome of that patient.
Okay, well, thank you, everybody. I want to wish everyone a happy and healthy weekend. Once again, thank you to city staff and all the people at Joliet that pulled together. I think the weather's going to break, so we could do some outside social distancing. I just want to thank everybody and wish everyone a good weekend. I do want to extend our sympathies to the people who have lost loved ones and the people who are currently suffering with this disease in Joliet and throughout Illinois. So thank you again.
Thank you.